Good day. We are glad to be with you again on the program this midday. The dangers of COVID-19 are still there, and that's why we've decided to come back or still maintain our discussion on COVID-19 or the coronavirus. And we gathered over 3,000 cases in Cameroon already, which means that the problem is still there. So the world is still grappling with an unprecedented pandemic with about 4,609,339 cases recorded worldwide. Europe and America put together have over 3/4 of the infected cases. The deluge or disease flood, which was thought about Africa, is not yet happening, or should I say has not yet happened. Maybe it's still coming ahead. But our focus today will be on the use of medicinal plants and the African remedy to COVID-19. Will Africa save the world, or Africa is saving itself? Because most parts of the world don't want to adhere to our traditional medicines. But we have experts who've gone to the white man's school and are studying our plants and will be able to attest, because we gather from the scientists themselves that all the most molecules in the drugs which are manufactured in our pharmacies come from plants. So why refuse to take the natural remedies if they are there? We'll handle that with us. We have quite a good panel on the program this midday. That's an epidemiologist, Dr. Felix Asa. You're welcome.
Thank you, Joe. It's my pleasure.
We have our media consultant, Eugene Fungwa. You're welcome.
It's a pleasure to be here.
And a researcher in medicinal plants in Cameroon. He decided to go traditional. You know, when you do medicinal plants, sometimes they think that you are supposed to be a traditional doctor, but he's just decided to wear the traditional outfit from where he comes from. That's Manu Division. Dr. Gabriel Agbo, you're welcome.
Thank you.
Okay, let's set the ball rolling with what the papers were feeding on this week. Our press review, and we're glad to say Emmanuel Avenu is back.
Cameroonian newspapers have taken reporting on COVID-19 to heart as a way to help keep the monster at bay. Cameroon Tribune sees mayors at the fore fighting against the killer pandemic in their municipalities. To The Voice, COVID-19 terror in Kondengi prison. Quote an inmate, "I watched an inmate die looking at me." Then The Post newspaper brings hope, writing, Kondengi prison administrators begin treatment of untested inmates. At a time, repression against the non-respect of anti-COVID measures begins in Yaoundé on the horizon. Yet social distancing remains a problem on Cameroon Tribune, as conflicting figures of COVID-19 deaths, recoveries, critical cases rock Cameroon on the Post newspaper. The Guardian Post reports on famine that looms over Cameroon and other poor countries hit by COVID-19, just when Finance Minister upbeat about COVID-19 response after IMF loan on the Voice newspaper. Before the Health Minister warns against COVID-19 stigmatization on the Guardian Post at the time government set up modalities for the school resumption on Cameroon Tribune. Then UB sacks Agbobala over an examination question on the Voice newspaper. Then Agbobala heads to court on the Star newspaper as FACO lawyers wade into UB Agbobala saga on the Guardian Post. Just when U.S. congressmen asked Biya to release detained journalists on the Post, The Horizon says time for Biya to act on U.S. lawmakers' letter on Anglophone journalists in Kondengi prison. Then legal counsel documents fact sheets on detained journalist Samuel Wazizi's case on the Star newspaper. Then the Pope, UN Secretary pressure Biya to declare a ceasefire on crisis in Northwest and Southwest on the Guardian Post. The same story carried on the Voice newspaper. At a time Manthe mayor shot dead on the Post, the Guardian Post reports that suspected Ambazonian fighters assassinate Manthe mayor. Just when Amba Boys kidnapped CDC estate manager for Ide Now on the Star, B rescues 17 kidnapped CDC workers, manager still in custody on the Post. Bafia Diocese then gets replacement for late Bishop Benoit Bala on the Horizon. has over 350 million CFA francs missing from PCC employees self-help scheme on the Guardian Post. Then the CPDM Central Committee summons quarreling Santa CPDM elite on the Guardian Post just when Article 8.2 dangles over SDF Senate Vice President Senator Emilian Keze on the same paper. Truck crushes 5 children of same family to death in Buda as demonic fire ravages Limbe Court of First Instance on the Star newspaper. Let's now end our press review with the story on the Guardian Post, where a teacher has died after a scuffle with neighbors over stolen plants. Emmanuel Mahen is reported to have died Tuesday in Mesasi neighborhood in Yaoundé after confronting the parents of the children who, according to him, had been stealing his plants from his construction site. The supposed parents of the plant thieves are reported to have used machetes to manhandle and torture the teacher, who later died from internal bleeding due to the wounds inflicted on his body. Until I come your way again, this is your Hour with the Press.
Thank you, Emmanuel Avemiu. Let me give you a global picture of what the situation looks like as of 10 o'clock this morning. The world has about 4 million or 4.6 million infected cases with 312,147 deaths recorded and 1.7 million recoveries. The U.S. alone has 1,624,666 with 100,699 deaths. The European continent, the UK is the hardest hit in terms of the number of deaths recorded, with 34,466 deaths recorded thus far. But Russia remains the most infected country on the European continent with 281,752. But in Russia, only 2,631 deaths recorded thus far. On the African continent, Egypt remains the hardest hit with 612 deaths out of 11,719. But the Republic of South Africa has the highest number of infections with 14,355. Cameroon, as of 10 o'clock this morning, has recorded 3,047 cases with 139 deaths and 1,553 recoveries this far. Those are the most affected parts of the world, including, of course, Asia, where Turkey has the highest infection rate with 148,067 infections and 4,069 deaths. But the situation is improving, or rather, the graph is flattening in a number of countries, but the situation hasn't subsided. So I'll turn to our experts and begin with the expert in infectious disease, or the epidemiologist. Where are we in terms of infections in Cameroon? How would you describe it?
Yes, Joe. You just gave a very good picture about the current statistics at the day-to-day in Cameroon. But from the perspective of an epidemiologist, we have to look beyond the simple numbers.
Okay.
We have to look at the trends, what is happening and what has been happening.
Okay.
I think if you remember, in one of the past programs, I talked about the epidemic curve.
Yes.
And basically what all countries, all the world is struggling to do is to flatten the curve. Flatten the curve means that you don't have too many new cases popping up suddenly in the health system, because that is the danger of the COVID-19 pandemic. If you have too many cases that come up suddenly, it can overwhelm the health system and crush the health system. So in Cameroon, like in many parts of Africa, we have not yet reached the slope, the sharp rise that has been noticed in some other parts of the world. But it doesn't mean that we are doing very well, because if you look at the statistics in Cameroon, for example, and you look at what happened in the month of April, and you compare it with what is happening in the month of May, you would notice that the curve has increased a little bit. The slope of the curve has increased a little bit. What do I mean by this? If you look at the total number of cases we had in the month of
April.
I mean, we started April with about 200 or 300 cases and ended April with about 1,800. But just for the 2 weeks in May, we have moved from 1,800 to 3,000. So you see that the curve is getting steeper.
Steepened a bit.
It has steepened a bit, which is not what should be happening. What we would have hoped to be happening would have been for the curve to be getting flatter.
Okay.
Because if the curve is getting flatter, it means that you don't have too many contamination, too much community transmission. And so the cases would come up progressively and would be able to be absorbed and managed by the healthcare system.
Now, initially, we had these cases that were being signaled in the country came from those who flew into the country. Now it's community transmission. How do you call social transmission?
Now it's community transmission. And ideally, when you have an outbreak of a disease in the community, you don't want what epidemiologists call the reproductive number. You don't want it to be very high. You want to struggle to maintain it as low as possible, hopefully below 1, which means that the rate of transmission is slow enough so that cases would come up gradually. But if the reproductive number gets very high, then the propagation of the epidemic, of the outbreak, accelerates really rapidly. And that is what was seen in countries like in Italy and even in the United States. And with all the resources that those countries have, you would bear with me that you saw how Italy struggled and even had to get assistance from other countries in terms of medical personnel. So I think in Cameroon we really need to reinforce the control measures such that the increase in the curve, in the epidemic curve, which is being noticed in this month of May, should try to be flattened back so that we can get back to a gradual increase in numbers which we can manage. Yeah.
Okay. Now, schools are supposed to start on the 1st of April, not everybody, just examination classes. Does that instill any confidence in you, given that at least if all the other students and pupils don't go back to school, they can be able to manage that situation, at least the hygiene situation or preventive measures at that level?
The first thing with managing an epidemic, such as an airborne pandemic like COVID-19, is social distancing. And social distancing has different dimensions. One of the most effective...
I prefer physical distancing.
Well, yeah, physical distancing, social distancing. But one of the most effective measures of social or physical distancing is avoiding groups where people congregate together, because the transmission in communities such as that get very high.
But there are times when students say, all of us have been tested negative, and so we can socialize.
Now, if you have been tested negative,
that's the more reason why you should.
That's the more reason why you should
physical distance.
You should avoid getting into groups. Okay. Because then you expose yourself to get contamination from somebody who is positive. And secondly, in Cameroon, I think we don't yet have the full picture, because what the government has been doing so far is targeted screening, where if they know that you have been exposed to somebody with COVID-19, then they look for contacts and screen. Or if you have symptoms, then you come up and you are tested. But there is no community testing, systematic community testing. So we don't know the penetration of the virus in the community. We don't have that information.
Okay. So the way he speaks, especially the last observation he's made, does that give one the impression that we could have many more people in the neighborhoods with the disease, which have not been put on the statistics?
Yeah, I think that's a point that we've made here over and over, that the virus is still on the move, especially when you also take into account the fact that you can have people who have the virus who do not show any symptoms, and therefore will not come into the testing programs, as he has just pointed out, which means that those people will continue to infect others.
If you don't show any symptoms, can you infect some?
I think the science now tells us, yes, it's possible that asymptomatic people can also infect others, and they may remain asymptomatic. It doesn't necessarily have to progress into a situation where they have symptoms. So that's a huge risk. And like he pointed out, when you move out and you go to the markets and you see how it's been very difficult, because the option the government had taken this time was relax public gatherings but increase the use of face masks. All you need to do is walk into a market and you'll find out that it's a very difficult measure. It's not working. It's difficult to police, first of all, 22 million people. It's going to be difficult to ask every one of them to have a mask on when they move out. We don't have the capacity. The police cannot be everywhere at the same time. And as I pointed out earlier, you cannot trust people to make good decisions. That is why restrictive measures are usually the best ways of managing crisis.
But when you have situations like this and the public is being sensitized time and again on the dangers of moving out without their face mask or greeting people with hands, as has been the tradition, what else can we do to help them change their attitudes towards old habits?
There are many studies that have shown that awareness and knowledge doesn't always lead to change of attitude. And that's because there are a lot of other factors that are involved. One of them is the burden of taking up the new attitude, which is wearing a face mask, the inconveniences that come with it. So people are in their mind weighing the costs of wearing a face mask against the chance of not getting into contact with the disease. And the easier decision there is that they do not wear the mask. It's happened, if you look at communication for development studies, especially in public health across the world, there's been strong evidence that no matter how much you teach people to wash their hands, people are hardly washing their hands properly. It's not only about COVID-19. So in this specific case, I think it was a question of restrictions. I did advocate quite early in this outbreak that we needed to have taken bolder measures and actually asked some workplaces to shut down, reduce the opening of non-essential businesses, and only allow people out when it's necessary. That has not happened. We now have to deal with trying to convince people to wear face masks. It's going to be hard, but that seems to be the only way we can stay safe now.
Anthropologists or social scientists say that if you attach a punishment to a new measure, it forces people to adapt.
Yes, that's why it's the repressive approach works. Now, let me use a different picture. If you put a street light and ask people to stop when it's red, if there are no measures to punish people when they go through the red light, people are going to go through the red light. People generally are more likely to take the decision that provides the most convenience to them. And stopping at the red light is not a convenient decision. And it's the same, you can apply that to
across
any
the board.
sector of...
Okay. Now, Dr. Gabriel Agbo, one of the things which we remark about the statistics which we have in Cameroon is that we have the recovery rate is high, and these are the ones that we see who have gone to hospital, and there are people who have not gone to hospital and still recover. Am I right?
Correct.
Okay. And we've had an increased use of tisanes and so many of our traditional drinks and herbs and all whatnot. Like somebody who is specialized in research on medicinal plants, how would you look at what is happening now?
Thank you. Apparently now, what is really happening is that many people are running away from the hospitals. They don't want to go there to be quarantined, tested positive and quarantined. So they rush to the traditional doctors. And many traditional doctors are giving reports of how they are overwhelmed with patients who either show symptoms or feel that they are infected or that they have been exposed. And they take the prescription of the traditional doctors. And according to the traditional doctors, these patients do recover. Many of them have come to my office and registered their product that they want to test the efficacy of the product they want, and they are very certain that their product works because they have seen it work with patients. So the high recovery rate, I can give attribute to that, and also our nutritional habits. because we have medicinal foods that we take ignorantly, and it goes to boost our immune system and fight any coming infection.
Okay, I will not go back to the food because we discussed that with a nutritionist the other day. But when you say people come to your office, are these herbalists? And have you been able to see from what they have done that there's something scientific or there's something helpful in this or that that medicine or that leaf or that herb?
Yeah, the traditional doctors, they have their concoction. You don't know what is in there. So you cannot pinpoint that this is a particular ingredient in that concoction. However, they claim that when they give this to patients, the patients recover. And we have asked them that, like scientists, we want to see certain proofs. Can you show us the patient before or during treatment or after treatment? Can you show us some medical reports to confirm that they were positive and then after treatment they became negative? And that is where there is a problem, because upon all the over 40 traditional doctors who have reported to my office, none has come out
with statistics, as you requested.
Yes.
Now, what about your reaction to what His Grace Monseigneur Cleda has done?
Well, I think Monseigneur Cleda is succeeding because he has come out with maybe the number of patients that he has treated, and considering that he is an archbishop and he has the Catholic hospitals under his auspices, he can actually prescribe, give those his formula to the medical doctors working under him, and they give him back the statistics. I think he has some data, and I discussed with my boss, and he's making plans that we need to look at such data and see how we can help in order to improve either by standardization, the dosage, and maybe why not producing in large quantities, because we have that capacity.
Okay. Now, have you followed what's happening across the African continent?
Across the African continent, yes. We are a center for research on medicinal plants and traditional medicine. And across the African continent, we are monitoring what is happening. We know what is happening in Cote d'Ivoire. We know what is happening in Madagascar. We know what is happening in Tanzania and many other African countries, and the formula that they are trying. And so far, so good. They have claims of treatment, but those claims need to be backed with biochemical data that shows changes in the immune system, and some other parameters, which can be convincing scientifically. And more so with what they have in Madagascar is similar to what Monseigneur Cleda is having. And what we say as scientists is that we can say, yes, at a desperate situation where there is no treatment, no vaccine, no help, I think patients can rely on that as long as they get their solution for what they need.
They get healed.
They get healed.
Have you seen the product coming from Douala, from Monseigneur Cleda?
Yes, I have seen it.
Have you gone with it to the lab?
For the lab, we have not gone with it. I don't have a sample of it. We have seen it. And we saw it when the Ministry of Public Health went down to Douala.
Were you associated?
No, we're not associated at that level.
Okay.
Yes. So, and one thing is that in the lab presently, we cannot isolate the virus to test our product or the product on the virus. The main thing that we can do is to look at some of the symptoms like pneumonia, like coughing, you have fever, high temperature, and all this, we can look at if this formula or concoction do resolve some of these symptoms.
No.
So what we do is symptomatic and not directly on the virus.
Even the modern medicine are treating the symptoms of the disease because they say they haven't had all they need about the virus itself. Now, when you look at what the Africans are doing and that there is no solution to the disease inside, wouldn't you recommend as a scientist that because it provides a remedy, you go for it?
Sure. We don't discourage any patient or anybody, even minus COVID-19, patients who come to us and ask for contacts or traditional doctors, and we give them, and they go and take their own chances in their hands. But as a government establishment that we are, we cannot recommend that you go to a traditional doctor for a particular solution, because it is against the ethics of what we stand for. We as scientists need justification for whatever we do.
Okay, you just made mention of the fact that the Catholics are administering this drug in their hospitals, and they have statistics on who has taken and how it has helped. Is that not enough scientific proof to say this concoction or this remedy is a solution to this disease?
It is good enough until we see those data and analyze them, because you have to also analyze those data. Then we can come with conclusions about the efficacy of the product, and looking at also the possible, if there is any, side effect, and then compare it with the health benefit that will provide for the patient. And then we can now say, okay, it is possible or advisable to go for it. But without doing that, we cannot pronounce that this is the solution.
That Cameroon has found a solution.
No, we cannot.
Now, would you accept that the president makes a statement on what the contributions which the clergy and other traditional people, especially Monsignor Cleda, has done to be able to back him up, like the president of Madagascar did? Is that necessary?
Yeah, I think in things like this, political support is very helpful. When you know that, if we remember the challenges that someone like Professor Numangu went through when he was even using Western medicine methods to do research, you realize that political support is very useful in helping researchers go ahead with their work. And I think the first thing is to recognize that it is a science which is completely different from Western medical science. I think the error we've made in the framing of the discussion has been like, one is science, one is not science. I just think that two different sciences, and those two scientific communities need to understand each other and begin to communicate each other. And the government is the authority that needs to facilitate that exchange.
The Ministry of Public Health was in Douala.
Yes, I mean, I'm not saying they're not doing it. I'm just saying that that's what needs to be happening.
Okay.
And we're seeing it for the very first time. It's in the past, it's been more of
behind the scenes.
Behind the scenes, but in public, it was more of a conflict relationship. But now we understand that it's helpful that we have this political support that's coming in. Also, he mentioned the testing and trials and whatever goes there. I don't think you can apply the same protocols for formalizing or standardizing Western medicine to this process. It needs new protocols, and I think researchers need to start thinking about what kind of protocols really work for this kind of medicine. How do we know for sure that it's working without necessarily going into the complexities of isolating viruses and isolating molecules and going into a test tube and working them out?
One of the most interesting things about what's happening to us Cameroonians and to people who have taken the drug, which Monsignor Cleda has done, is that the patients are not quarantined first. They are just tested positive, and then they go and take it, and they are cured of the disease. Does that not give a more palpable proof that there's something happening with what has been produced?
No, let's not mix things up. Quarantining has to do with reducing the risk of transmission. It has nothing to do with the healing process. So it's really about controlling the virus. Okay. So you may not know if they have contaminated other people before they eventually get well or not. So it's really not about, and it doesn't say anything, in my view, about the efficacy of the drug. What says something about the efficacy of the drug is that they came in sick and went on well.
Okay. Now, you wanted to react first, then I'll ask you one question.
Yeah, I want to react on a few issues.
Yes.
The first one is about the use of human beings as testing animals. It goes. I cannot speak to traditional medicine or herbs, but I can speak to methodology. It is unacceptable in bioethics to use human beings as testing animals.
They are not testing.
So,
they are just giving drugs.
But then there are testing.
Have you taken any African cortex or any herb before?
Well, I mean,
this is a science, like Eugene was saying, that has evolved over time.
I don't say no, Joe. What I'm saying is, if you come up with a product and you say that that product treats a disease, and then you go straight to administer that product on human beings, then you are using human beings as testing animals. Methodologically speaking, it's unacceptable. You need to be sure that your product would, one, do no harm. Because what would you choose, to die from your disease or to die from your treatment?
Okay. What about modern medicine, that almost all of them have side effects, right?
Yes, they have, but the side effects are quantified, they are estimated, and you know what to expect. You see, the problem with rolling out things that have not been tested using a valid methodology, and again, I'm saying, let me emphasize, I'm not speaking to the traditional medicine part of it. It's the method that is being used.
Okay.
Can I just say,
yes, I'll come to you, Dr.
And this is the problem, in that in his idea, the right methodology is the methodology that has been approved by standardized Western medicine. And the point I'm making is that you need you probably aren't going to have the same methodology. I'm going to take the example of today, Western societies are beginning to incorporate Asian medical practices into their listening, which are based on the work of the mind. How are you going to test that on mice or on other animals? We need to recognize, and this is the kind of argument that has slowed the development of African traditional medicine, in that each time it comes up, we want to bring standards that have been developed for a different kind of practice. I would prefer that you put it African
pharmacology.
It's medicine, or African medicine. Let me call it African medicine outright.
Medicine, instead of putting the word traditional.
I think even when you talk about when you talk about Western medicine,
yes,
Western medicine is, let's call it European traditional medicine.
Yes, it is.
But now, if you need to sieve the flour and remove the bad grains. Whatever is good from the methodology that they used to develop European traditional medicine, we don't have any reason to reject that methodology.
Okay.
Let's go to the research.
And let me come in. And just like the last speaker was saying, the Western medicine has laid down principles or protocols for their validation. We have gone to school to be able to learn those protocols, to apply them in our own medicine. So that we can also improve on the African traditional medicine. I don't think we have to throw those protocols away and start looking for new protocols to validate the African traditional medicine. For example,
we
have to move from somewhere because of the dignity of human beings, of man. The dignity of man, we cannot directly take a medicine to try it on a human being. It is wrong. Even in animals.
There is a scientific product.
Yeah,
there is a scientific product. But these are herbs and vegetables which have been eating.
Accepted. If you take it as food, you don't need to validate it anywhere. If you want to take it as in your local area, in your village, you can prepare your concoction and drink. Whatever comes out...
I don't understand what conversation we're having.
Let me come now. Whatever happens to you, it regards you. But as a government that wants to take care of its citizens, the government wants to do things the right way so that every medicine, every traditional medicine can be controlled and save humans from side effects. Then we have cell lines. We have animals. When it doesn't kill the animals, we use cell lines that are from the human system, like your liver cell lines, the kidney cell lines, and we do this study with them. When we are sure that this traditional medicine cannot provide any toxin, because we have standards. If we cannot get to that, then we say, okay, based on this, we can now apply it to humans.
Now, just hold on. I want to ask you a question.
Can I just say something here?
Yes.
Because, for example, I'm sure you eat mushrooms, right?
Yes.
But you know that a single slice of the wrong mushroom can kill you.
Can kill you.
Of course.
Yeah.
So it's not because it's a naturally occurring product that is not toxic.
No, it means that you have not gone for the right mushroom. And over time, we have learned, our people have learned that this mushroom is bad and this one is good, right?
Yep.
Without going through the lab.
Yes, without going through the lab.
It was as a sacrifice of human well-being and human lives.
And
now, do you want to sacrifice human life again?
I think
test new products.
I think we need to put the conversation in context.
Yes,
let me
orientate us so that we go in a more orderly manner. Now, the way you speak gives me the impression that Africans are discovering medicine now.
No.
But these are things which they have lived with over time. And these African remedies have provided solutions to societal problems.
Correct.
So why do we put to question what we have over the years? Even we have communities that have never had contacts or that have had limited contacts with the Western world and Western medicines, but they have remedies that work. So why not use them, quantify them, and provide them for everybody? Now we put them to question.
I like that. Quantify them is what language? That is the language that we learn in school. How do you quantify them? You have to prescribe a particular dose for that medicine. Let me just come with this example. We have traditional medicine. It works very well. But imagine yourself where a prescription is given you. Take a glass. A glass is how many milliliters? What size is that glass? Is it a tumbler? Is it a whiskey glass? Is it a wine glass? So when you take a glass of it, how do you describe it? Then secondly, the period that you harvested your plant sample. The traditional doctor is not always there to provide this for you. You may need to go and harvest that plant sample. Is it during dry season, during rainy season? The ingredients there is different. So if they say, take 5 leaves of this plant, that 5 leaves are different from a dry season to rainy season. The content is different. So now the standardization comes to say that, okay, if we harvested 5 leaves, this is the active ingredient we are looking for in that leaf. So how much of that active ingredient is available? That is where you standardize it, so that anywhere you go, you can apply the same principles and you get the same thing that came from the beginning, that you had from the beginning. So there is a production problem, a production run, which differs.
All right.
Yes, and I also want to say ecologically, the soils are different. A plant that grows in the north, when planted in the south, may not produce the same active ingredient. So there are a lot of things that we have to look at, and then we now improve on our traditional medicine so that it can be standard wherever you go, and you can even produce a large quantity to be able to supply to Cameroonians.
All right. Yes,
you see, he has just described a scenario that wouldn't work with medicine. And that's exactly what the point I'm making. That this medicine, it's so different that you need a different set of guidelines. Let me know his protocol. You need a different set of guidelines for standardization. I didn't say you don't need to standardize.
Okay, yeah.
You need a different set of guidelines. You're mentioning now environmental factors and so forth. Yes, that's true. And that is really why the research has to move in a completely new direction on these issues. I understand the question of
ethics.
The ethical worries. Yes, it's valid. But we now need to look at what are the ethical challenges. We don't just import ethical questions into a completely new field. That's why I open up by saying that perhaps the first point is to consider them as 2 different sciences. And each of these sciences will develop. We can borrow from each other. The modern medicine has been borrowing from traditional medicine for centuries. So this medicine can also borrow from that. Correct. But unless we treat it with the respect that it deserves, we're not going to go forward. We're going to stay into this thing that, you can't tell the number of glasses. The idea now is to work and say, It's a number of glass. How much glasses? There's some of this medicine that you have to take with alcohol. How much alcohol should go into that concoction?
Yeah, that's it.
Or how much alcohol is toxic? It would create more problems. Oh, medicine medication come with alcohol in it all the time. Most of the solutions. But yes, we need to. But we need to go into different directions in this research and find a way to cooperate at some point.
I like the way you put it earlier on when you said, in the absence of a solution, everything that helps is possible, is useful. Now, but the one thing which we have coming in, and if you say sometimes your reaction, the way you react, makes me understand why the Western world is reacting to what we are doing, the way they are reacting. And how would you see the reaction of the Western world to what we are consuming and what is helping us?
Joe, let me start by saying that I am not from the Western world. I'm an African in Africa, and I live in my community. But what I'm saying is that we have learned methodology from science, from Western science, which we can borrow and use.
Do we have something we call an African science?
Science is universal. Science is universal. Like he just said, even Western science borrowed many things from African science, and it doesn't discredit Western science in any way. So we could also use knowledge or techniques or methods from Western science which would help us. And let me go further to say that I don't think the problem is about whether the medicines are helping us or not. If you observe closely, some of these people seem to want to obtain, let me say, authorization from the West. But if you are sure about what you are doing, and you know that you have used rigorous methods, and you are helping your people in the right way, then you don't need you don't need approval from the West. Let's forget about thinking that WHO must come and approve, or the United States must come and approve.
I like to hear that.
Yeah, so, but then we are also researchers, we are intellectuals. We can study what we are doing and give ourselves a pass mark, without waiting for it to come from outside. But the problem is, have we done the necessary to be able to accept that or give ourselves a pass back? That is where the problem is. And there's a lot of focus on fighting the virus. If you go back to history, you would know that fighting a virus is a very difficult task. Very, very difficult task.
Okay.
You could treat the symptoms, you could control the outbreak, but without fighting the virus, if you just stop the spread of the virus, after some time, those who will die without any medicine, and those who recover become immune and provide herd immunity. And there's a lot of debate about how outbreaks have been controlled, viral outbreaks. And usually it is not because there's a medicine that treats the virus, but it's just because this virus is contained and neutralized by the human nature, by the organisms themselves. Okay? I think in the recent history of medical science, call it Western medical science if you want, the only viral disease that has been eradicated is smallpox. All the viruses, they live with us. They would come, they would go, and they would come, and they would go. So we have COVID today. It doesn't mean that COVID will disappear by the end of the year. We would live with this virus. But we need to find measures. We need to look at ways to contain and control the outbreaks in the community. Not necessarily because we must get a molecule or a medicine that will kill the virus. That is a very difficult challenge.
Thank you so much. I'd like us to have a break then before we continue our debate, and I'd like us to go to Alice Mbaye. She did a report on our attitudes, or the attitude of our Bayam Salams in the markets.
At the To the Market in Yaoundé, the COVID-19 pandemic seems to be a joke to some traders who continue to expose foodstuffs on the ground and on very untidy environments. They care less about wearing a face mask or practice hygiene and distance measures. While at the Fundi market, the case is not different. even though some traders say they make some efforts to protect themselves and their customers.
I wear my mask before rendering a service to any customer. When there are customers around, I serve them. After that, I do wash my hands or use my hand sanitizer.
Customers testify they implement hygiene measures when they return home with their goods.
When I finish buying my goods, I go home, wash and sterilize them before using. I wear my face mask to protect myself and others.
While health specialists say it is very risky to move about without a face mask.
The importance of wearing a face mask is that it creates a barrier between you and the person wearing it. If someone is sick and does not wear a face mask, there is a high risk of the individual contaminating others. This is prevented with a mask on.
Following measures outlined by the government to fight against the spread of the COVID-19, such as wearing of face masks and hygiene practice, must be respected.
Okay, so what best way should Africa adopt in the face of the coronavirus?
I think that our greatest hope is in using physical measures, hygiene measures, to slow the spread. Apparently, our environment is already helping, because even though we have not done the studies in our environment itself, but studies from a research group in the US have shown that this virus doesn't fare too well under heat, sunlight, UV light, and ultraviolet rays, which is what we have in abundance in the tropics. So our environment may be helping, but now we need to assist the environment in terms of checking the spread, slowing down the spread, because we cannot claim to have the resources that some of these Western countries have in terms of managing the patients in the hospital. So if we allow these numbers to go up, we can easily crush our health system. And don't forget that COVID-19 is one disease. People still suffer their high blood pressure, their diabetes, malaria, typhoid fever, etc., etc. Women still have to go to the maternities to deliver. So we need to, while looking at COVID-19 like an emergency because it's an outbreak, we need to make sure that we don't let it go to a level where it would crush the health system. And if you look at the statistics in Cameroon, with the relaxation of the measures, because I mean
the preventive measures,
the relaxation, place, at the end of the last month, you notice that for most of April, the active cases, like people who had not yet recovered or died from the disease, were hovering around 800s. Okay, but in the month of May, for the past 2 weeks in the month of May, the number of active cases have gone up to almost 1,400. You know, so these are people who have been tested positive and they have not yet recovered or lost their life to the disease. So if we allow these active cases to keep increasing, we can very easily get to a position where we will not have enough hospital beds, we will not have enough ventilators, we will not have enough oxygen extractors to take care of these people. So I think that we really need to relook at the preventive measures and enforce the preventive measures, because like he was saying, if you just step out of this studio and go to the next market, people are in huge groups, no efforts to keep a certain distance from others. Use of masks is
possible to keep distances in our markets?
Good.
That's the point.
Good. No, but some countries have tried it. In India, where they have a lot of also local markets, they actually...
Similar ones to like what we have?
Yes, they did.
More populated than ours.
More populated, but they were able to enforce social distancing where not every trader was allowed to sell, and they kept a certain distance and customers would line up respecting norms. Okay? Now, can we do it? I think we could.
Why not?
I think we could. Now, I'm not a decision maker, but the decision makers could brainstorm and come out with ways to do this, to control these gatherings, these huge gatherings in the markets, to reduce even people who go to churches. Because even though the government puts restrictions about going to churches, if you go to some of these churches, what the people do is they just say the government said 50 people. Okay? So they get into a small room and pack 50 people. That doesn't respect anything. All right?
Okay. So the physical distances should be reinforced. Now, given what's happening in terms of the African approach, should we say that we should be taking our herbal remedies in spite of what's happening, if at all it provides solutions?
Yes, I think that the Monseigneur product, like the Ministry of Public Health went to Douala. After the exchange, it is important that that product can be taken and given to the patients who are being hospitalized after passing through ethical clearance. Cameroon has an ethical committee that studies every project that is being applied to humans. Okay. So they can look at that and then recommend such a product for testing in patients and being monitored by other people and to corroborate with the results that the Archbishop is got. Also, there are things that can be done. We look at the mechanism of transmission or the mechanism of infection of the coronavirus, and we realize that symptoms like pneumonia, you have high temperature, like I mentioned earlier, and in our forest, we have plants that have antimicrobial activities. That is why azithromycin is an antibiotic to treat pneumonia. So we have plants that can treat pneumonia. So we can also look into that in our recipes in our different regions, villages. What are the plants that are used for malaria treatment there? What are the plants that are used for treatment of cough? What are the plants that have anti-inflammatory activities? They look at all that, and you can make a drink for yourself, and you take. Now, while waiting
maybe,
to see
as the researcher here, you can prescribe some. And, those that have...
Yeah, I'm just saying so.
Okay,
so that,
I'll come back to you shortly.
Okay.
Let me give Teke. Just be thinking about what you can propose that have those those active ingredients inside. Yes, Teke?
Yeah, quite a good number of reactions. Most of them positive. Kwa Akonwi Ngwa says, an African solution is very possible, but not in a rush, because we might not know the adverse effects of a drug over time. And Ngwesang Alphonse Tembu says it's a spiritual problem, and God is testing nations, and people should repent and wash their hands with the blood of Jesus. Asontia Mill says COVID-19 is not regional, and the solution can come from everywhere, so Africa has a high possibility of producing one. Sibe Asamao says an African solution is possible if Africans believe in themselves, while Menge 4 says it's a spiritual problem and Africans have to pray. Munge 4 says, African herbalists, this is your time to shine. Let no one intimidate you. And Shi Tosho or Kikyang says, had Africans been given traditional medicine the attention it deserves, there would have been no need worrying, because Africa is rich in natural resources that could provide the necessary medication. And Paco Paxson says COVID-19 is taking ravaging dimensions as the death tolls continue to increase. And
I want you to end there.
And consuming lettuce full of vitamin C can help, so African traditional medicine is also very useful.
Okay, thank you very much, Elvis. I'd like to begin and end with Dr. Abo. So preventive measures, the best for now?
I think the best we can do for now is to respect hygiene. Washing of hands frequently, not touching things and then putting your hands on your face, because that's one of the ways the virus is transmitted. But especially distancing.
Okay.
Distancing both in terms of physical distancing as well as social distancing, use of masks, avoiding crowds, and unnecessary gatherings, because in gatherings this virus thrives like nothing.
Okay.
From a development perspective, one of the most important lesson I think that's emerging is that we're learning that we're not prepared for anything. That's the first thing, and that in our increasingly mortality than even exposure to the disease. Our markets are crowded because people are poor. People cannot afford to stay home.
So to stock food at home.
To stock food at home. So I think going forward, strategies should include building resilience. We're going to have another major outbreak, I can guarantee that. And so we need to be ready for it, so that people are not desperate enough to take unnecessary risks.
You mean another virus, not only corona?
Another outbreak, I don't know what's going to be. But if you look at the world, it's always coming.
All right.
Even the corona itself can get worse.
Okay.
So we need to be ready.
Okay. Dr. Agbo?
Yes.
Maybe from your laboratory, you know that this plant is from this region and this plant, and you just said earlier on that putting together this, that can help. So what can you help? What can we use now that can help from your research knowledge?
Yes, I will begin by saying that presently my institute, we are testing the herbal products from traditional doctor on some of these symptomatic treatment, and it's showing some positive data that are being obtained. And for now, as per what we can say that has come from our laboratory, from our own research results, some anti-malarial products that we have, and we are getting authorization to put them in the market. And these anti-malarial products are from what do they call it? There is Fagara. I only know the scientific names. I don't know how they will call them in the local parlance. Yeah, you have Fagara, you have there is Cinchona, which you already know that the quinine was isolated from Cinchona back. And then we have Paquetina, and then we have, and for those that can, and those that can help stimulate the immune system, you have your ginger, you have your garlic, you have they call it tanchot in Bayangi. That is piper nigrum, which is used as a spice in a traditional soup. And all this, if in the morning you can prepare, you can have turmeric. These are common ones that you can find in the market around. And they have been shown either to be rich in some of the nutrients like zinc. They have dilating of the red blood cells and preventing clot in the gastrointestinal walls. And then also they can keep you away from cold. So if you make a tea of ginger, garlic, and turmeric, and with lemon, or you are healthy in the morning, and you can be healthy the whole day and prevent infection.
Quantity to take?
Quantity is relative, but until...
And that's how traditional medicine is.
Yes. These ones I give because they are nutrients and they form part of our daily diet. So there is no fear of taking a lot of it.
Okay.
Thank you.
No, I just quickly wanted to add something. That one of the things I think the research to begin to think of is also the economics of African medicine, especially with respect to patenting. There's been some work to try to see how do we protect our genetical resources in our African forests. The Western people have come and taken these things for so long and selling them back to us at cutthroat. And knowledge that they come, and you mentioned quinine, knowledge from the communities is taken and brought back, and sold at very high prices. So,
and that's why we want to promote the use of African remedies, because and you scientists will need to help, and help fast, so we can be able to provide that African solution we're talking about. Thank you so much, gentlemen, for coming, and we looking forward to being with you again same time next week when we'll be on with another in the series. We invite you to stay on with CRTV. Tam Tam Weekend is following on CRTV, and on CRTV News, the news will continue.